Good morning, everybody.
Good morning.
Good morning.
Good morning.
Dr. Manoharan.
Good morning. Good
Welcome.
morning, Mr. Malali.
Thanks for coming early morning.
Yeah.
Yeah, Dr. Pranan, Ananya,
Dr. Malali, who can?
yeah, I think you
Yeah,
guys can start.
yeah, yes, yes. So, good morning, everybody. Welcome to the third day of this international conference on coronavirus genome. First presentation we have of Dr. M. Manoharan. So it gives me an immense pleasure to introduce Dr. Manoharan. He has done MD in acupuncture and currently he is a senior consultant in acupuncture department at Sri Sri Holistic Hospital, which is a multi-speciality hospital group in Hyderabad. He has also started a acupuncture institution called Acupuncture Foundation. He is a consultant at holistic medicines at holistic health care. Among his awards and honors are he is trained by a team of Chinese medical doctors from all World Federation of Acupuncture and Moxie Prostration Society on various diseases. His area of expertise is scalp acupuncture, ear acupuncture, electroacupuncture, past life therapist, and body acupuncture. So over to Dr. Manoharan.
Good morning. Good morning, everybody. Can you hear me?
Yes, we can hear you.
Can see my screen also?
Yes.
Yes, sir. Good morning, organizers, my co-speakers and participants. And this gives me immense pleasure for participating in this kind of international seminar. Basically, last 2 days which was going on, it's really a fantastic effort by Bangalore Genome Center and Sarva Sumana Association. And this is the beginning, because the world is struggling with COVID-19, and at least Bangalore Genome Center has taken an initiative in getting all the domain experts in one single platform. Whether we arrive at a solution or not, but I think this is the beginning of a solution. All integrated approach to the medicine should really be successful, and I really thank Sarva Sumana Association and Bangalore Genome Center for taking this highly appreciable effort. My topic is acupuncture, and we'll go ahead. Acupuncture is basically an energy science. This energy science has been practiced in India for more than 5,000 years. And it was in ancient India, and it was being practiced in China also, and many of the Asian countries, in fact. We can find references for this acupuncture in Indian classic, medical classic literatures called Sushruta Samhita and Saraka Samhita. Both are Ayurvedic classics, But then acupuncture has been mentioned as Suchibedar, that is a needle therapy, and Varmasikitcha. So these references, we are able to find it in this classical text. There was some practice called Rakta Mokshana. Rakta Mokshana means taking out 2-3 drops of blood for healing skin diseases, which is called bloodletting in traditional acupuncture. Even this has been mentioned in this classical text. Unfortunately, unfortunately, the Ayurveda, it was a part of Ayurveda, and Ayurveda has not processed this particular side of Ayurveda or acupuncture, you can say that. And we have literally gone back in these particular therapies. Chinese have nourished it, and we are learning it from Chinese now. It's good. Whoever gives, it's our child, but nourished by Chinese. Before really going into the topic, I would like to give a brief about acupuncture, because these various domain experts are available in this conference, and I want it to be little meaningful to these people also. So I would like to just give you a very brief introduction of this acupuncture before really going into the prevention and control of this COVID-19. Traditional acupuncture sees human as a connection between heaven and earth. Heaven being the yang side and earth being inside, the human being is continuously interacted with these forces throughout his life. If you take anything in the world, it can be classified as yang and yin. Yang is a energetic substance, vibrating thing. It's a vibrant thing. Yin is a cool, mild, and subtle thing. If you take yang subjects, wind is yang, fire is yang, heat, aggression, ascending, summer, daytime, hyperactive status, loudness, brightness, inflammation, these are all having the yang character.
Because of this, we can't go outside also. To barber shops open.
Recreation, descending, winter, nighttime, hyperactive status, mildness or softness, dullness and depression, these are considered to be yin. Basically, if you see that, suppose if you are having a tinnitus, I just would like to give a small example. If you are having a tinnitus, and if it is having a loud noise, and we will segregate it to the yang disease, and maybe it is an excess which is shouting at your ears. And if it is mild hissing sound, it will be coming from a yin disease, maybe kidney yin deficiency. This is how we really apply these techniques in traditional acupuncture. The whole life is about yin and yang. If there is a balance of yin and yang energy in the body, it is a good immunity. It's an indication of a good immunity, which we call it as health. If there is a lowered immunity, that means there is an imbalance. If there is an imbalance of yin and yang, we call it as a lowered immunity, and the disease can arise. When we are at lowered immunity or imbalance of yin and yang, a virus or bacteria can enter into our body and it can become a disease. There is something which keeps us continuously moving in our life. That is a vital force which kept us moving, which is keeping us moving till our death. This force is called chi. With the different context, people call it differently. Ayurveda people call it as prana, and homeopathy people call it as life force, and Japanese calls chi as ki, and yogic people will say it is a spirit. It may be called as breath also, and in physics it's the overall energy. this energy throughout our life. There is something within us which keeps us moving. It's called chi in traditional medicine. What is there in the macrocosm is in microcosm. Microcosm being the body and macrocosm being the universe. When the universe is controlled by the five element, even our body is also controlled by five elements. There's a slight name change with the five elements of traditional acupuncture. They call it as wood, fire, earth, metal, and water. Liver and gallbladder, these two organs associated to wood nature, and heart and small intestine, pericardium and triple warmer. It's a different concept, triple warmer, which you cannot be able to understand. That is the fire element. Spleen and stomach, which constitutes the earth element, which nourishes us, and lung and large intestine becomes the metal part of it. It becomes a shield for shielding us from different viruses, bacteria, and external pathogens, and it gives us immunity. And kidney and bladder is water, and this is a big cycle actually. And here, one element keeps supporting the other element. In the COVID-19 situation, we see spleen and lung. The lung is affected first, and then spleen is consequently it is affected. These two elements, if you see, the earth and then it is lung. If you see the cycle which is passing through this external cycle, if you see that one element passing the energy into the other elements. So here, the element which is the source element, we call it as mother element, and the receiving element, we call it as, this is metal, lung, we call it as, in this particular two cases when I am talking. So this is the son and this is the mother. So whenever mother gets certain things, it is passing on to the son. So these two gets affected in the COVID-19 situation. And a person, the five elements, they affect us on the human body also. Heat is being produced by heart, and cold is being produced by kidney, and dampness is being produced by the spleen, and dryness being produced by the lung. And what is this wind? Here I am not talking about external wind, I am talking about internal wind. Whenever this internal wind, which is the responsibility of the liver in traditional medicine, and this wind activates and make everything to spread faster, whether be it a coolness or a heat or a dampness or a dryness, it makes the things faster, and then it affects at a very, very faster speed. So here if you see there is a dampness here, and there is a dryness. It's marked in green and white, and this dampness is produced by spleen. That is the responsibility of the spleen. And if the spleen is deficient, the dampness increases, and the dampness gives rise to the phlegm. If you see the lung, its dryness, basically the spleen becomes the part of if you see this picture, the spleen is earth, and then the spleen gives everything to the lung here, because spleen being the mother. So in this case, if you see the dampness produced by the spleen, that is the phlegm produced by the spleen, is being pushed into the lung, because lung being the sun here, right? So let's see, when an element goes out of balance, what kind of diseases, what kind of situation we will face. If lung goes out of balance, that is a metal element, what we call it as a shield, we get allergies, asthma, wheezing, cold and cough, fever, short of breath, skin problems, and grief. For Western medicine, grief will be looking slightly alien, but the thing is, in the traditional medicine, the lung is responsible for creating a grief. If lung energy is not proper for a person, and for small reasons, he will be grieving. And this grief gives him more unbalance, and it becomes a cycle. And in some of the cases you have seen, some of the COVID-19 cases, we have also seen some skin rashes. You can understand from this. And if the earth element, that is the spleen, goes out of order, we get digestive problems, constipation, diarrhea, diabetes and hypoglycemia, weak muscles, weight gain, nausea, edema and worry. Again, this grief, worry, emotion is a big subject in traditional medicine. Emotion is having a big part in affecting the human life or human health, you can say that. So here worry is an element of earth, which is spleen. Whenever we are getting worried or the spleen goes out of balance, worry becomes more, and worry becomes more, the spleen goes out of balance. This is again a cycle. So let me tell you about something about meridians, because it's all about acupuncture points and meridians in acupuncture system. In the left, you can see that there are 12 meridians listed out, but actually 12 main meridians and 8 extraordinary meridians are there. But we generally see that 12 meridians and one meridian which goes from nose to down, which is called a conception vessel, and the one which goes through the spine, that is GV, that is the governing vessel, we say that. Ren meridian and the DU meridian also we call it as. There are 14 meridians which covers all our body. You know, it's like a river when it is flowing through the landscape. It takes the water and nourishes all over the area which it is flowing. Similarly, our body is traversed by these 14 meridians, and they carry the chi throughout our body and keep every organ and every single part active. And these are called, these pathways, energy pathways are called meridians. They run under our skin, slightly below our skin surface. So we will be able to needle these points. So the energy pathways running through the body, they are called meridians. On the meridians, you will find certain points marked on this, some dots are there. These dots, we call it as acupuncture points, through which we can insert small sterile needles and influence the quality and quantity of energy which is flowing through this meridian system. Basically, acupuncture is a practice. We insert fine needles, sterile needles on the acupuncture points, which lies on the meridian pathway. And the size of the needle is very, very thin. It is hair-like. You'll say that 0.12 millimeter to 0.04 millimeters. It is very thin. Mostly it is not painful. And we have different techniques for assimilating this energy through these acupuncture points. One method is acupuncture, inserting needles. Another one is an acupressure, and another one will be you can do the electrostimulation on these meridians or the points, and we can also do the laser. Through the laser, we can simulate this point, and it will be completely painless. And through the heat also, we can change the status of this acupuncture points. Moxibustion is a form of a heat therapy. Yesterday, Dr. Bakshi has discussed about this. It is taken from Artemisia vulgaris. This dried leaves of this Himalayan range herb. It has been taken, it is rolled into a cigar, and it is lighted. It goes to 300 to 400 degrees. And to heat the acupuncture points indirectly above the surface, or we use ginger or ginger paste. Over that we heat this point so that it becomes activated. So let us see the functions of the lung in TCM. The functions of the lung is it governs the respiratory systems, and it is responsible for the defensive chi in the body. That's a shield, is what I told. It improves the immunity, secretes mucus, it controls the skin, controls sweating, that opening and closing of the pores, which releases and balances our internal and external temperature, is done by the lung actually. Managing water pathways, continuously interaction with the kidney and lung manages the water pathways. And ability to smell the objects, that's part of the lung. and it controls the affections of nose also. If you see, there are two things which you can see that, the one is the ability to smell. People have lost COVID-19 patients have lost the ability to smell. And this is one of the particular indication your lung chi or lung energy is deteriorating. And rhinorrhea will be the nose affection. So these are the lung functions in TCM. So let us see the functions of spleen and stomach in TCM. Spleen and stomach governs digestive system, and it is responsible for the nutritional chi. It absorbs, it takes whatever food we take from that, it takes the energy, absorbs the energy, and then circulate it through the system. And it improves the blood production, secretes saliva, it controls mouth and lip, absorbs, of course, I told nutrition from the food, nourishes muscle and fat, ability to taste, controls memory function. So there is a slight difference between the Western medicine and this. We have seen in some COVID-19 patients, disorientation has also been observed. Ability to taste has come down. These two things in TCM, it is taken care of by spleen and stomach. So let me go to the actual data collected from some Chinese hospital. It is the data from Jinin Tan hospital from Wuhan. So during the first stage of the epidemic, and the data of patients who have been taken from January 1st to January 20th, and 99 patients have been taken, and they are all confirmed COVID-19 patients. The group has been formed, and they have analyzed what are the symptoms presented. Fever was there 83%. That means 17% even without fever, the people were affected by COVID-19. Dry cough was there 82%. Shortness of breath 31%. Muscle pain 11%. Mental confusion, this is what I said, the spleen's function 9%. Headache 8%. Sore throat 5%. Rhinorrhea 4%. Chest pain 2%. Diarrhea 2%, and nausea and vomiting 1%. Here I have put it in two different colors. One is blue, another is white. The white, whatever problems are there, it is connected to the lung. And blue, whatever I have given here, it is all connected to the spleen. So we confirm here that lung and the spleen are the first affected things. And initially it is lung because the dry cough, fever, shortness of breath, that covers the maximum portion of that. And after that, spleen and stomach, we will say, it is slowly getting affected. So now what is the prevention strategy? We know it is the lung and spleen. Lung gets affected first and spleen consecutively. And the idea is to stop this beginning. We have to create a hostile environment to the coronavirus. So it does not, hold and survive on this, to make this difficult to the coronavirus to survive and hold on to this body. There is some situation which is cold, damp, and stagnated. Stagnated means not energy moving conditions, are the breeding ground for virus. This virus plays 2020 cricket match in these grounds, cold, damp, and stagnated grounds. It plays a cricket 2020 match. If we have to win over this match, we have to drive these things away by increasing the heat in the body and increasing the warmth in the body, which will drive away the cold condition. So these two things, removing cold and dampness, is done by acupuncture and moxibustion here. And mostly in the preventive stage, we are going to the moxibustion because it is the cold and dampness. So we give heat energy to remove the cold and dampness in this case. So basically what we are trying to do is improve the immunity of lung and spleen. Okay, there are 12 points given. They are only for academic interest, and acupuncture people will know that these points are on different meridians. One is stomach, spleen, large intestine, pericardium, REN, which is called the consumption vessel, bladder, and DU, which is a governing vessel. So the stomach 36 is the point where we can do 15 minutes bilateral. I mean, this meridians run both sides of the leg and both sides of the hands. So both sides we can do moksha bhakshan for 15 minutes. All the other points we can do it 10 minutes moksha bhakshan every day. And at the point DU14, which is there at the back side. So this we can do the needling or moksha bhakshan. If there is no fever, we can do the moksha bhakshan. If there is a fever, it is better to handle with the needles. If the needles have to be put and it has to be retained for 20 minutes on the body. Just given a figure of whatever these 12 points we have given. You can see that the first 2 points, stomach 36 and SP6, they are on the leg. The second 2 points, PC6 and LI4, pericardium 6 and large intestine 4, they are on the hands. And there are 4 other points which are there in the front, that is consumption vessel, what we call it as. So consumption vessel 4, 6, 8 and 12, these 4 points are there in the front of the body, and other 4 points are at the back side of the body. Somehow, I don't know, it is by a kind of balance I can observe from these figures. So back is covered, front is covered, leg is covered, and hands are also covered. Now, what basis these points have been selected? What are the functions of this? What are the characteristics of these points? So we have gone by what we are trying to improve. Our main intention is removing dampness. So we have selected 7 points here for removing the dampness. Dampness which creates the phlegm that gets obstructed in the lung, and that we want to remove it at the first level. And the overall immunity building, there are 5 points selected out of this. Overall there are 12 points. You can see many points, but they are repeats here. So here I am going by function wise. So many points are repetitive. And building immunity, we have 5 points. And improving the digestion. Digestion is the center of the system, and then once the digestion is good and the absorption is good, blood production is good, and the movement of energy in the body is good, then that builds the immunity and chase away the virus, basically. So improving digestion is an important point here. The 5 points out of these 12 points covers improving digestion and improving the overall energy, chi, and 5 points of this covers the improving energy. And spleen immunity, there are 7 points which out of this 12 improve the spleen immunity. And lung immunity is 2 points are given. There are 2 points which tonifies the blood and make the circulation better. And when we get energy stagnation at the chest, the oppression in the chest, and then chest pain possibly when there is a stagnation. So we will have to move the chi in the chest mainly because it affects the lung. There are 2 points selected for moving the chi in the chest. And then when I come to the last, calming and clearing the mind, which is very important in these cases because we have seen the emotion, what causes the diseases. And many of the diseases are somatic diseases we call. And clearing this mind is a very big thing in be calm and clear the debris from the mind, clear the worries from the mind, because worry affects spleen, and then the spleen system gets into trouble. And the deepest worry becomes grief actually. So for that we have selected 3 points. And yesterday there was a question to Dr. Bakshi. Basically whether this acupuncture points works physically or mentally or spiritually or emotionally. That was the question. So basically I would like to say that, we say in TCM, large intestine is a meridian which is responsible. I'm not talking about as an organ, I'm talking about the meridian, which also involves that organ, is responsible for clearing the debris, clearing the toxins, clearing the unwanted things from the body. And in the Western medicine, you will only see that, it is large intestine is responsible for clearing the food residues from the body. But in TCM, it is not only like that. Any debris, any toxins, it can be urine, it can be menstruation, which is also a toxin which has to be cleared, and any clearance is the responsibility of this. In fact, the clearance of the debris or clearance of the toxins in the thoughts in the mind is also responsibility of a large intestine meridian here. I'm not talking about the organ. I would like to go a little away from the subject because the subject has come here about clearing the toxins. It will spiritually also work. It has worked mentally, clearing the thoughts. It works physically by clearing the residues from the body, toxins from the body. It spiritually also works because this medicine, traditional acupuncture, sees things in a different way, body, mind, and spirit concept. Spiritually, I would like to say that we carry a lot of burdens from the earlier birth. If those burdens which have to be in baggage, it has to be left down there, left out there, which we carry, it also causes certain mental emotions and physical diseases. And there are certain points which we can say that this is also, this large intestine meridian is also responsible spiritually clearing the baggage what we are carrying from the earlier birth. And we have left out three things. This diarrhea, pneumonia, cough. So our intention was, improve the overall immunity, improving the spleen immunity, lung immunity, keep the blood moving, keep the chi moving, and remove the dampness and cold from the body and clear the mind. When I am selecting these 12 points, it also acts on diarrhea, it also acts on pneumonia, and it also acts on cough. So this three, the points, some of the points what we have selected, there are 2 points which are directly used for pneumonia. So these points also helps this thing. Based on this selection has been done. Now, having completed the portion of prevention, let us come to the cure portion. If at all, if the people are having any diseases, basically the TCM or a traditional acupuncture does not see the name of the disease. We don't go by the name of the disease. We go because each disease can create a different symptoms for the different constitutional bodies. So the medicine applicable for one person is not applicable for the another person. Like homeopathy, like Ayurveda, even traditional acupuncture does not see the name of the disease. It only see that what is the reactions that disease has created in that particular constitution. So we combine the points and then we start grouping it to a pattern, and that pattern we treat, not the disease name or a virus basically. Now, if a person gets affected by an infection, it can be a simple flu also. So, because it's a stage 1, it can be a simple flu also. There are 6 different stages I have mentioned. And a common cold and flu is a very normal thing whenever the seasons are changing. So, here it need not be a COVID-19, it can be a simple infection. The symptoms will be fever, chills, muscle and joint pain, fatigue, sore and dry throat, tongue is bitter, the rapid floating pulse. The floating pulse indicates the diseases in the external area of the body. It has not really taken deep root into the body. And thin white coat in the tongue can be observed. The white coat is always cold, right? Coating becomes more when the dampness is more, and white coat is a cold thing. So these are the symptoms. We call it as invasion of damp cold in the lung. So this can be a simple cold or flu. Based on these points will be selected. I am not going to discuss the points here because Dr. Bakshi has covered it yesterday. We go to the scenario 2 of the suspected infection period. The symptoms can be fever, fatigue, discomfort in the gastrointestinal systems, muscle pain, nausea, vomiting, diarrhea, abdominal distension. Because it's a spleen and stomach, all the stomach and spleen symptoms will be there. And the tongue will be white and greasy, white indicating the cold and the greasy indicating the dampness, that is the phlegm is getting accumulated into the body, so it becomes greasy. The pulse will be deep, slow and powerless pulse. Unlike Western medicine pulse taking, we have got 12 pulse in traditional acupuncture. So spleen pulse is measured in a different area and lung pulse is measured in a different area. So we need not get confused with the pulse, because on the lung we said it's a different kind of a pulse, that is it's a floating pulse, and in the uh, spleen we are talking about a slow, deep, powerless pulse. So this indicates dampness has increased, the coldness is still there, but it has affected the spleen and stomach. So this we call this damp cold in the spleen. According to this scenario, the points will be selected. And then if the disease is further progressing, or somebody has come at this stage, basically after damp cold and slowly the phlegm start developing, the spleen is the producer of the phlegm, and in the TCM we call it the spleen is the producer of the phlegm and lung is the storage yard of the phlegm. The spleen produces phlegm when it becomes excess, and it just puts into the lung and gets stored into this. And here the symptoms will be fever, fatigue, dry cough, dry throat, muscle pain, nausea and vomiting, tightness in the chest, loose stools. These symptoms are the combination of a lung and spleen symptoms. So what is different from the earlier two slides, what I have shown is here dry cough and chest tightness has been added here, and this symptom will be there when the disease has a little more progressed into the lungs, and loose stools also will be there. And the tongue will be slightly from pale to red, it can be changing, that is from the cold to the heat it is changing. And the white greasy coating, white it is still in the coldness, greasy it is basically dampness, this coating indicates. The floating but effortless, that is soft pulse, weak pulse will be there in this case. So this is a group of symptom, what we call it as damp cold, but it has started blocking the lungs. Now we'll go to the next stage, which is an intermediate stage. Stage 1 and stage 2 will be there before it getting severe. And in this stage, further the disease has progressed, and you'll get the symptoms like cough, white or yellow sputum. Yellow indicates the heat actually, and phlegm difficult to expectorate. If it is a simple cold and damp, if you expectorate cough, much of the phlegm will come out. In this case, when it is turning into a heat, it is difficult to expectorate. The chest will be tight because chest is loaded with the phlegm. Shortness of breath, difficulty in breathing, stomach distension, abdomen is bloated, appetite is lost, stools can be loose. And these are the symptoms what indicates dampness obstructing upper and middle warmer or a burner we say. Basically upper warmer contains heart and lung, so in this case it indicates the lung, and the middle warmer it is spleen and stomach. And the pale and red tongue with a white greasy coating, symptom is similar to that. I mean the tongue picture is similar to the earlier one. Floating soft but weak pulse, this is also similar to that, but this is a slightly progressed, and it is turning from cold damp to damp heat here. In the intermediate stage 2, it has really become a toxin. The virus has started obstructing the lungs, and then we can say that cytokine storm, what we call it as, and the multiple production, and it affected the cells. And the symptoms will be high fever and cough with yellow sputum, which is a heat, difficult to expectorate phlegm, again chest tightness, shortness of breath, wheezing on exertion. When you start doing certain things, walk or climb the stairs, you start wheezing. And bloated abdomen, constipation. Constipation is also a heat, you can see here. And here the tongue will be red. The base of the tongue will be red because it has really become a toxin, it has become a heat here. And the yellow greasy coating indicates still it is dampness is there. And along with it can be damp and it can be dry because it has gone from cold stage to the heat stage. The coating of the tongue can be dry also in this case. And the slippery, that is a lot of phlegm is there, the pulse is slippery, and it's a rapid pulse, high fever, it is a young condition, what we will say, the rapid pulse will also be there. This we call the epidemic toxin obstructing the lung, and beyond this point it is going to get severe, and we have to be very, very careful at this stage. And the next case, it has gone into a severe this thing if it is not properly taken care of at this intermediate stages, and it can cause a collapse. It's an extreme obstruction in the lung, severe breathing difficulties, asphyxia. At this stage you may need a mechanical ventilation support. Person can be restless, or he can go into unconscious stage, and sweating, cold body after sweating, and dark purple tongue. The purple indicates here the stagnation. Energy is not moving completely and it is stagnated. It has become purple. It is shown in the tongue. And this energy stagnation, if it is there in the lung area, again the tongue area is divided into so many portions. You can see the frontal portion is heart and chest, lung, you can say that. So there the purpleness is there. That means the chest is fully loaded and it is very, very severe. And there can be a thick and dry coating at the tongue. A large floating pulse, but it will be completely strengthless. This is an extremely bad condition. It can cause collapse, and accordingly the points have to be chosen. And yesterday we have discussed about the points. And then from this stage, if a person has crossed, definitely going into the recovery stage. The person his lung and spleen is completely deficient of chi energy, and he will not have strength, and we have to recover him from this chi deficiency problem. There will be a shortness of breath and fatigue, nausea. There will be a poor appetite, fullness of abdomen, distension, sticky stools, loose stools, and tongue will be swollen, which like an earth with the water, it becomes a swollen. So the tongue will be swollen, which indicates the dampness in the spleen, and it is deficient, and that is the tongue picture. And the deep pulse and slow pulse, and it is very, very weak, very slow pulse. So he's slow pulse indicates the weakness. So he is on the recovery period, and this will indicate the weakness actually. And recovery stage 2, after which the patient can be sent back, and he will have chi, that is energy and blood deficiency. Blood circulation is not proper. Our purpose here is to improve the chi and improve the blood. So here also you will find some shortness of breath, fatigue, poor appetite, insomnia, dry mouth, night sweats, restless or dizziness, the weak neck, knees, legs will be weak, the urine will be scanty, the tongue will be pale red because he is recovering from heat now, and still it will be pale. The coating is gone now. It's a scanty coating. It will be very light coating will be there. And because the patient is weak, you will find a thin and weak pulse. And this is the picture. Once this stage is crossed, the patient can be comfortably sent back from home to home. So we have covered what are the pattern differentiation at different stages of this disease, and accordingly the points will be selected. As I told you, we do not go by the name COVID-19. We go by what the symptoms are produced. Basically, I would like to say these references we have collected from Journal of Chinese Medicine, and there is a guideline from World Federation of Acupuncture and Moksha Societies, which covers, it's a large organization which is covering a lot of Chinese doctors. And this is also taken from an article from Lancet. And there is a Chinese classic called Shan Han Lung, which means on cold damage. And there is an article given by Underneath the Epidemic, written by Brian McMahon, and Dr. John K. Chen has written an article in E-Lotus publication, how the COVID-19 is currently treated in China. And it is also based on our understanding on the traditional acupuncture and whatever clinical cases we have treated on lung-related problems. And the concluding remarks, the traditional acupuncture is a system which has got a very large potential for treating not only COVID-19, and in fact, this COVID-19 in China also has been treated with herbal medicines, which we can do it with our Ayurveda, Unani or Siddha, and then they were also adapted to acupuncture. So Western medicine was also used, but this Chinese traditional acupuncture or traditional acupuncture is got a very huge potential for treating many conditions, many viral conditions which normally we treat. And really, we have not treated the COVID-19 because of the legal situation here in India, but it has got a lot of potentiality. And in India, it has to be explored. There is a lot of more than 1 lakh healers or the doctors are there, and people are practicing. We are not prohibited to practice in India. Definitely we can practice, but it is not legalized. And if the improvement has to happen, it has to be legalized, and proper curriculum has to be done, and then more and more acupuncture doctors will be seen. And it's really an economical option for our country, because we are still called a developing country only. We are not a developed country because we are in the verge of we are developing much, of course, but then our economical situation is still a little lesser than the other countries, Western countries. So the traditional acupuncture could be a good option for this. Hopefully our government will look into this complete legal recognition of the system, and it will put us at par with Western countries. So I come to the concluding part of that, by this thing. Thank you for listening to my lecture, and then thank you very much.
Thank you, Dr. Manoharan, for a wonderful talk. Any questions from the
You can
participants?
take over, sir.
Yes. Ananya, can you please take over the session, the questionnaire sessions?
Hello.
Hello, Ananya. Okay, I will only take the questions. Any questions from the
Hello.
participants? Hello? Yes, Dr. M. Yes. Yes, there is a question from Mahesh Kumar. Can this method of acupuncture be collected with the Ayurveda, as these both are related to 5 elements in nature? Dr. Manoharan, there is a question for you. Hello? Dr. Manoharan? Dr. Manoharan? Dr. Manoharan? Can you hear me, Dr. Manoharan? Dr. Manoharan, can you hear me? Dr. Manoharan, can you hear me?
I think you should call him.
Yeah, Kirti, what has happened?